Is it getting blurred, ma'am, or something?
No, I put something in front of it.
Okay, ma'am. No problem. No problem.
Okay. All right, I see. Then where should we start then? Yes, you can see me now, right?
Yeah, we'll be starting in a minute.
Okay. So for the slides, you will upload it for me, or I will upload it from
Yeah,
my side.
I'll be putting it on the screen, ma'am, and you can just click on next, and you can start presenting.
Okay, all right.
And ma'am, for the moderator, ma'am, can you hear me right now? You can, ma'am. Can you turn your audio on, ma'am? We are not being able to hear you. Your audio, it's on the top of the left side corner. We are not being able to hear you, ma'am. It's on the left hand side top. We cannot hear you, ma'am. Okay, ma'am. So we'll start like on the right hand side, ma'am. You can see the chat box for the moderator. There's a chat box, ma'am, on the right hand side. Could you see it, ma'am? A chat box on the right hand side.
The chat box, okay.
Ma'am,
I
it
can
will
see
be
the
for.
chat box.
Sure, ma'am. Actually, the moderator will be getting a lot of questions on the chat box, ma'am, during the presentation, and she has to
Oh.
note them down, and she'll be asking those questions to you at the end of the presentation.
There is some problem with the setting, I think so.
Yeah, now you're audible. Now you're audible, ma'am.
Now again, I cannot hear you because I have changed the setting.
Got some problems, I think. Could you hear now, ma'am, or you've got problems?
Can you hear me now?
Yes, we can.
I cannot hear you now.
Ma'am, ma'am, could you speak, please, whether she's able to hear you or not?
Let me check just a minute. Can you hear me now?
Yes.
Yeah, I had to log in through phone. My PC is not
Okay, ma'am.
giving the mic.
So what we'll do is, ma'am, on the right hand side, you can see a chat box, ma'am. Uh,
Okay.
could you see it, ma'am? The chat box. Could you see the chat box, ma'am, on the right
It's
hand side?
enable chat. Yeah, chat box. Yeah.
Yeah, chat box. So therein you will be receiving questions, ma'am, during the presentation. So you will have to note down some important questions, relevant questions to the topic, and you can ask them at the end of the presentation, ma'am, after the
Okay, fine.
presentation. So
Okay,
during
fine.
when ma'am is presenting, we'll be turning our audios and videos off so that no disturbances are created in the background.
Okay, okay, fine. Fine.
Okay. So ma'am, I'll be starting by introducing you, and you'll be introducing madam before we
Yes,
start.
yes, sure.
Okay. So a very good afternoon to everyone watching us live from across the globe. So as we all know that we are gathered here for a webinar on health instruments, development and validation, organized by Association of Pharmaceutical Research in association with Biotechnology. So we welcome you everyone to the webinar. So without much delay, I'd like to introduce our moderator for the afternoon, Dr. Shama ma'am. She's an assistant professor at Dr. D.Y. Patil Biotechnology and Bioinformatics Institute, Pune. Ma'am, we welcome you to the webinar, and I would like you to
Thank you so
introduce our
much.
speaker, and we'll start the presentation. Please introduce our speaker. Over to you, ma'am. Ma'am, you can start the introduction of the speaker, ma'am, if you can do.
Myself,
Ma'am, could you please introduce the speaker if you have the details, or should I do that, ma'am?
you can do that.
Okay. Okay. So, ma'am, we'll also welcome our speaker for the afternoon as well, Professor Dr. Nahlah, Council Member, Malaysian Academy of Pharmacy, MAHSA University. She's also the Professor Doctor in Clinical Pharmaceutics in Malaysia as well. Ma'am, we welcome you to the webinar. Uh, it's an honor to have you in this webinar, ma'am. So, I would like to want you to greet the audience and start your presentation.
Hello everyone. I should have said maybe some of you from the we are all from different kind of time setting. So I would like to say good morning, good afternoon, and good evening to all. So I hope all of you in a very good health. Despite of the challenges that we are facing, all of us are facing currently the pandemic COVID-19. Okay, I would like to thank to the organizer, for inviting me to share some of the, we call it like a knowledge that I would like to share with all of you. Okay, some of you may involve heavily in this kind of research method. Okay, and we know that it's very important for us to be well equipped so that the results that we get from our instrument it can be accepted at the highest level of evidence. Right. Sir Moderator, can you please switch on the slide so that all of the participants can have a look? All right. Okay. So as been mentioned, for today, I would like to share with all of you in terms of the development and the validation of the health instruments. Okay. Since that we only have 1 hour, I try to summarize as much as I can. And at the same time, you also see an example of a case study based on this topic development and validation. Okay. All right. So health measurement instrument, the word instrument can also be known as the questionnaire, also known as survey, also known as tool. Okay, and some they will mention is health outcome measurement. Okay, so in for a study that use this kind of instrument to collect data for your own research question or objective, okay, it has to make, we have to ensure that wherever that we are having inside our instrument, okay, must be reviewed and validated properly. Okay, in terms of, we will look at the beginning, okay, the process, on how of how an instrument be developed. Okay, as well, and we will go up to the pilot study and we will look at the example of a case. Okay, at first we always have to bear in mind, okay, when we want to develop a new health measurement instrument, okay, it must fit with our research questions, which is the objective. Okay, you are developing an instrument, definitely you want to measure certain things. When you wanted to measure that certain things must be able to answer your research questions, okay, and consequently your research objective. Okay, so in the process of developing the health instruments, okay, there should be a review of studies, okay, previous studies, whether there is whether there are any research that has been done in developing something similar to the instrument that you would like to develop, or you are reviewing some of those publications that can give you some inputs on how to create the instrument. Okay, and we will look into more into on how that you're supposed to define the construct of the instrument. Okay, and as well as looking at the aspect of the validity and the reliability of the study instrument, okay, and the pilot study. So for the validity and reliability as well as the pilot study, you will have more exposure when we share a case study, a real case study that we have conducted, and it has been published, okay, in a very reputable journal. Okay, so in the early stage of the development of the health instrument, we have to always have the things that we call as the conceptualization. Okay, what does it mean is that, in our instrument, we should be able to define what will be the construct of our instrument. Okay, is it just only based on one variables, or you have a different multiple types of variables? Okay, and these variables must be able to be measured. Okay, for the construct to be measured, okay, if the construct not directly with the observable, which is, we call it as a latent variable, so it is good to construct a multi-item instrument. Okay, if let's say the observable items are consequences of the construct, okay, so we will use the conceptualization of the reflective model. Let's say if we have the observable items, which are the determinants of the construct, so there is a name of the things that we call it as the formative model should be constructed first. Okay, for those that are thinking to have a multi-dimensional construct, meaning you will have a multiple dimension, okay, or sometimes people call it as multiple domain, and if let's say the domain is related to each other, then you are going to use the term that we call is as the multi-dimensional construct, whereby the construct or the domain that you're going to put inside your instrument is going to have a relation between one to another. Okay, you may have get used with the term. Some people say that I'm adapting this instrument from this kind of sources. or I'm adopting this kind of instrument from these certain sources. Okay, what will be the major things when we look at the term adapting and adopting? Okay, it is all depends on your research objective and your research question. If let's say you have something in mind, which is the study may have been conducted elsewhere, but it's just not happened yet in your own region or in your own state or country based on the extensive literature review. Okay, at this stage, if you have a time limitation, you may use the method of adopting, ADOP, adopting a research instrument. Okay, but of course you must have the permission from the corresponding authors. Okay, when you are using the adopting instrument, after you get the permission from the corresponding authors, okay, there will be a stage whereby you would like to use the same language, or you might want to translate that language into your own native language. Okay, so if you like to translate into your own native language, when you are asking from the corresponding author for the permission to use the instrument, you must mention to the corresponding author that I would like to adopt your questionnaires, and later we will translate it into our native language. Okay, and this we will use it for research purpose. Okay, by using the adopting method, it's actually, it's going to save some times, because for someone to develop a new questionnaires, it is actually taking lots of time. It's a very time-consuming process. Many people think that to develop a questionnaires or also instrument, survey or tool is very easy, but it's not as easy as what many people think of. Another way is like we will say the term the adapting. Okay, we adapt this questionnaire, we adapt this questionnaires, this survey, this tool, this instrument for this kind of sources. If you would like to adapt meaning you are taking that particular questionnaires and you will do some changes. Okay, you will do some changes, maybe in terms of the certain wording. You would like to suit your cultural or your cultural part, okay, of the world, and you would like to change this and there, here and there, okay, and maybe some of the item you would like to remove, okay, to suit your research objective. For adapting, you still must have the permission from the corresponding author, so that the corresponding author, that those that involved in the development of their questionnaires that you would like to adapt, okay, they must give you the permission, okay, and you must tell them that you are adapting this for the research purposes. Okay, and when we're using the method of the adapting from the other available instrument, other available questionnaire, survey and tools, okay, it can also save sometimes, okay, compared to adopting, we will use it straight away, okay, exactly as it is. The adapting, there will be some modification, but it will not be as time consuming as those that were willing to develop a new instrument. Okay, it depends on the research area. Okay, the reason why some people they would like to develop a new instrument is because of, okay, they wanted to come out with some instrument which is highly specific for certain diseases or for certain targeted population. Okay, and also if the instruments that have been found, which is the published instrument that have been found while they're doing the extensive review, were not at the stage of those published instrument or surveys, questionnaires, tools were not validated, or there's no process of reliability have been done accordingly. Okay. So in the types of measurement, okay, we will, or the instruments, the survey tools, okay, we have those that we call it as the self-report. Okay, self-report is the same like the self-administered. Okay, when we are developing the questionnaire, we have to think of if the questionnaire has been designed for the participant for them to fill up by themselves. Okay, fill up by themselves meaning it's self-administered. It's not the one that the researcher interview the participant. It's not. Okay, self-report, self-administered, meaning we will give to the participant and the participant will fill up by themselves. Okay. Number two, if the types of measurement that we would like to develop, it is more for the observation study. Okay, we use it for observation study, meaning the researcher will have like a questionnaire and they will tick those items accordingly. Okay, and also there's another type of instrument that we will use if, let's say, we would like to retrieve from an archival records. Okay, as well as the for the examinations, meaning here, if let's say we would like to test the knowledge of the respondent on something. Okay, what I can see from the search of the reviews that I've been looking around what we're having now currently in the scientific world. Okay, many researchers kept using let's say the words is like they stated that they wanted to measure or assess the knowledge of, let's say, of the students, of the healthcare professionals or healthcare workers, knowledge of the public. Okay, but when we look at the scoring system, it wasn't actually testing knowledge. Why it wasn't actually testing knowledge? Because they are giving some option for the participant to rate the scale. Okay, it's like from a rate 1 and 5. Usually when we are mentioned about testing knowledge, meaning there will be a definite whether it's yes or no. Then the score will be either 1 or 0. Okay, so we have to be very careful from the beginning when we wanted to develop what are the things that we wanted to, on how the instrument is going to be used for. Okay, because when we know on how the instrument is going to be used for, from the beginning, the way on how we construct, okay, where we construct and we include the domain, the variables, we should be able to really cater the targeted groups. Okay. For example, I give the example here. Okay, let's say some of the construct form an indissoluble alliance with a measurement instrument. Okay, for example, there will be an instrument to measure the blood pressure, the sphygmomanometer. So it's clearly stated that, okay, this sphygmomanometer will be used to measure the blood pressure, and then the readings, they may relate to the questionnaire that related to the hypertension. Okay. Another example that I would like to share is, let's say, if we wanted to look at the physical functioning. Okay, a physical functioning of a person, it can be measured with, let's say, from a performance test, or it can also be measured using the observations, or it can also be measured using by the interview. Okay, interview face to face, or the self-report questionnaire. Okay, so this is the part where we have to stick. Okay, if we want to measure the physical functioning, which of those that we wanted to use? Is it by using the interview method? Is it using the self-report, self-administered questionnaire method? Is it that we want to also include some observation, or there's some performance test to it? Okay, a little bit on the performance test. Okay, let's say for the physical functioning, the information that we will obtain is about what a person can do. Okay, however, for the interview or the self-report questionnaire, the information, the one that we obtain, is about what that particular person perceive that he or she can do. So it's different. When it's interview or the self-report, this is what they perceive. Okay, but when it's the performance test, it's like what the person can do. Okay. Another next aspect, which is very, very important, very vital, okay, in terms of the formulations of the items, and for us to construct the instrument. Okay. Number one, okay, we have to give some idea for us whether the particular instrument that we are going to develop, okay, we should know whether the instrument is very newly available, going to be available after we develop the instrument, or there's some other studies that have developed maybe similar. It may not related to the topic or the disease that we are going to look into, but the way on how they construct that particular questionnaires. Okay, This is what we say the examine similar existing instruments. Okay. For example, if you like to measure a self-efficacy in medication use, okay, so we will wonder, it's like, okay, is there any example of any instruments that are available for us to measure the self-efficacy of the patients in the medication, in the use of medication for, let's say, for diabetes patient, let's say for hypertension patient. Okay, so the extensive review is very important, so that if, if let's say you may able to find some similar existing instrument, so you can look at the way on how they develop the instrument, what will be the theoretical philosophical thing involved, okay, while they are constructing that particular instrument, whether those suit with your research question or your research objective. Okay, if you're not having something which is exactly similar, which is the one that we mentioned, the words adopting, okay, it can be at the stage of adapting some of their theories, okay, their philosophical, their conceptual framework on how they develop, so that it can suit to your area that you would like to test on, or area meaning your research question or research objective that you would like to investigate on. Okay. Number two, when you would like to formulate the items, you must know what is your target population. Okay, so the questionnaires, if you would like to disseminate it to the population, let's say primary school children, secondary school children, okay, teenagers, adult, okay, geriatric, okay, healthcare professionals or healthcare workers or some professionals, the way on how the items, the words that you're going to put there will be different. Okay, the level of the difficulty of the items also will be different. The way on how you arrange the questionnaires, the instrument also will be different. Okay, because those target population have have their own way on how to look into those particular item, and this should be able to make them answer your instrument, answer your questionnaires. Okay, if let's say I give example, why is the target population is very important. Let's say you wanted to test the knowledge, okay, of, for example, of public on the I use the example the pandemic COVID-19 okay. Let's say we wanted to develop a questionnaire on knowledge of let's say knowledge of public to COVID-19. Okay, maybe compared to knowledge of COVID-19 among healthcare workers. Okay, so when we construct the item, do you think that we will put exactly the same words in the items for those that we're going to develop for public, or those that we're going to develop for the healthcare professionals? The level of difficulty, it will be different for those for the healthcare professionals, because they must know the things in depth about the COVID-19, from the source until the beginning of the management. There will be some medical jargon will be involved in that words, okay, in the items that we're going to test on them. However, if we are using the target population public, okay, the words, the item that we're going to put is the words that we know the public should be able to understand, and because they understand, they will be able to answer your items of your questionnaires. Yeah? Another important things that we have to bear in mind when we wanted to formulate the items. Okay, it is good for us to talk to the experts. Okay, to the experts that really know in the subject matter of the research that we would like to do. Okay, so we can use one of the things we can use in-depth interview techniques. Okay, so we can ask them, based on the review that you have done before. Before you talk to the expert, make sure that you have to equip yourself first. Okay, so once you have equipped yourself first with extensive review, okay, so you can go and talk and discuss with the expert, okay, on how for you to come out, what are the points, the important points for you, according to your research question or research objective, so you should be able to formulate the items that will be able to answer your research question and research objective. Okay, You'll be surprised that, if you talk with the experts, like say we are using this pandemic COVID-19, okay, if you talk to these specialists, the one that really involved at the end care of the COVID-19 patient, they will give different inputs compared to those that work at the very beginning of the, they are not involving at the ICU, let's say not in the ICU area, but it will be different for those that just do the swab testing. Okay, so that's why I mentioned before, the target population is very important for you to be identified first, okay? And then when you talk to the expert, okay, using what you have in mind about the target population, you should be able to discuss with these experts, okay, what will be the things that the expert would like to know and what they would like to see the outcomes of the instrument when you disseminate it to the targeted population, okay? And also, when you formulating the items of your questionnaires, you have to bear in mind, okay, on how to formulate the response option. Okay, sometimes people will take it very easy. Okay, they will just say, yeah, just use this Likert scale, just use this 3 Likert scale, just use 4, just use 5, just use 7, and some go up to 9. Okay, or they may wanted to use the visual analog scale, VAS, just to score 1 to 10. But the question here now is, what is the importance for you for that particular instrument that you wanted to do the visual analog scale, VAS? There must be a reason why the instrument being developed using the VAS. There must be a reason why you develop your instrument, you wanted to use the Likert scale, either is 3, 4, 5, 7, or 9. There must be a reason, okay? Certain instrument when it's developed, they don't like they don't like the respondent to select the neutral part. Okay, let's say example we use the Likert 5 scale. They put 1, 2, 3, 4, 5. So let's say 1 is from the strongly disagree and 5 is strongly agree. So number 3 usually they put neutral or no comment. Certain studies they don't like to give that particular option to the respondent, especially if the respondent is someone with certain level of education. Okay, let's say the targeted population is healthcare professionals. Okay, so if the design meant for the healthcare professionals to just choose strongly disagree, agree, or strongly agree, then they will not put the neutral, because for healthcare professionals, healthcare workers, there shouldn't be no comment section. Okay, so there always must be a reason. Even the response option is very important. And when we look into the response option, we also have to bear in mind the instruction to answer the items. Okay, many questionnaires that have been found that it was the instruction to answer the items, it was written poorly. When it was written poorly at the beginning from answering the questionnaires, it will just give the respondents some idea, some creating own idea that whatever that they will put, that is what they feel it is. So the instructions on how to answer each of the items is very important. Okay, and also when we want to formulate the items of the instrument of the questionnaires, they must be you must have in mind what will be the appropriate recall period. Appropriate recall period is very important, especially if you want to do the retest for your reliability studies. Okay, and it's not just for retest reliability studies. It's also very important if, let's say, your study is not cross-sectional, but it's a longitudinal study whereby you would like to see the response, let's say at the very first week or first month, and then you would like to test the same instrument at the 2 months later. Okay, so it is very important for you to think of the recall period. Okay, these are the things that what I can see, okay, the mistakes that usually people do when they are submitting their papers for publication, especially when it's involving the instrumental development. Okay, number 1, there shouldn't be any causes of the variable. Okay, I put example here. which is not true. I have nothing towards the pharmacognosy. It's just that for our student here, pharmacognosy always seems like a difficult paper for pharmacy student. Okay, so I just use this. Nothing against the pharmacognosy. Okay, all right. For example, attitude toward pharmacognosy. Okay, a course of attitude toward pharmacognosy might be how one feels about the course lecturer. Okay, so they may be tempted to write an item, I enjoy the pharmacognosy lecturer. Okay, but what happened is it is possible for somebody to dislike that particular subject. They don't like the pharmacognosy, but they like the lecturer. So the item is not clear because there's some elements of the courses for that particular variable. Okay, so this we consider as bad item. Another bad item is when there's some elements of effects of the variable. Okay, I'll give another example here. Yeah? Okay, first the causes, now is the effects of the variable. Because a student who has a positive attitude, okay, they likely to attend class more. Okay, so the item that we may write will be I always attend pharmacognosy class. However, we have to bear in mind it can be possible for somebody to strongly agree to always attending pharmacognosy because they have a good attitude to attend any classes, but actually not like the pharmacognosy class. Okay, when we're having that kind of thing, we consider as a bad item. So they shouldn't be causes of the variable, number one. Number two, effects of the variable. The third one will be the double barrel items. Okay, what does it mean, the double barrel items? Okay, if you can see the item, they usually write something and then they will give the reason why. Okay, for example, I enjoy pharmacognosy because it is relevant to plantation. Okay, so we can see here there are 2 points to this item. Was it I enjoy the pharmacognosy and it is relevant to plantation? What if somebody, they just like pharmacognosy but they think it is not relevant to plantation? So what will be the answer that they're going to select? Okay, so this is the bad part. Okay, so this is what we consider bad item. So item, we must be very focused. We have to ensure that every item focus on only one point. Okay, we have to put, we are creating an instrument, we're creating questionnaires. We have to put ourselves in the mind of the respondent. It's like the empathy concept, for example. Okay, so we have to put our mind in the people's shoes. So the same with the questionnaires. We have to put ourselves in the people's mind. If we put double barrel items, we will question. It's like, okay, I enjoy pharmacognosy, yeah, but I don't think it's relevant to plantation. Okay, so please avoid this kind of thing. Causes of variable, effects of variable, and double barrel items. These are all, we call it as the bad design of item. Okay. Another thing before we move forward. Okay. We usually in an instrument we will have a section whereby we would like to take some of the information of the respondents. Okay. All right. We will have the socio-demographic data. All right. But and people usually think that it's very easy. We just put this age, gender, blah blah blah. Okay. But we have to bear in mind, when we wanted to take some information from the respondents, those information from the respondents is going to be our independent variables. When it's going to be our independent variables, these variables that we're going to use extensively in our statistical analysis to answer our research objective, research question. Okay. So when we are giving some response option to the respondents, okay, it must be very exhaustive. Okay. Meaning, number one, the participant must be able to find their response in one and only one category. Okay, if let's say you wanted to put age and then you give some range of the age, for example, let's say from 18 to 25, 25 to 32. So what you can see the mistake there. Just now I mentioned 18 to 25 and then I mentioned 25 to 32. The 25 been mentioned twice. All right. So as a respondent, which group that they should pick in? 18 to 25 or 25 to 32? It should be 18 to 25, 26 to 32. These are the mistakes that I've seen a lot. Okay, so make sure it must be when you are doing that particular category, it must be only one and only one category for the respondent to take. Number two, the response options that you given to the respondent, it must be mutually exclusive. Okay, meaning mutually exclusive. Each option is unique from the others. Okay, it cannot be similar things that been mentioned. Let's say you wanted to know the occupational history of the patient. Okay, you may put there public servant, for example. Okay, and then after public servant, that you mentioned at the bottom there suddenly, you mentioned a public hospital. Okay, public hospital is the same like public servant. So what is the difference? This is what it meant. Response option must have equal intervals, okay, as possible, okay, unless it resembles certain defined category. What does it mean? What does it mean here? Let's say I use example age. Okay, if we use age, if let's say we would like to see a certain a defined range. Let's say our questionnaires, the targeted population public 18 adult 18 years old and above. Okay, so we would like to come up with a range, for example, 18 to 28, 29 to 38, like that. So meaning it is every 10, 10, 10 each. But if we want to resemble a certain defined category, meaning let's say we want to put a category adult and geriatric. Okay, adult patient and geriatric patient. So we know that adult patient, it will be from 18 up to 64, and then the geriatric, you will put them more than 65. This is what it meant. Okay, unless if it's resembled to a certain defined category, then you can do that. Okay, when you are talking about the certain defined category, you must know the things what you're putting. I gave the example just now, adult and geriatric. So you know that this particular range is meant for adult and that particular range is meant for a geriatric. Response categories must be very specific. Okay, I'll give example here. Let's say people asking about the socio-economic status, and then the selection that given was low, medium or high. So as a respondent, on how they're going to pick whether they are having low socio-economic status, medium or high. Okay, so this must be avoided. It must be very specific. Okay, the same goes with the term the social desirability. Okay, this must be avoided. I give example of what this social desirability about. For example, we wanted to measure the educational level of the targeted respondents, usually in the public. Okay, when we ask about the educational level, we just put there illiterate, literate. So on how the respondent going to define themselves as illiterate and literate. So they shouldn't be this kind of thing. It must be avoided. Right? So moving towards the scoring of the instrument. Okay, we have come up with some items, we have some domains. Okay, and then we're thinking about the scoring of the instrument. Why the scoring of the instrument is very important? Because as it is very important, especially if you would like to measure certain scores, and that certain score you would like to tell the particular level associated with that scores. Okay, for example, if you wanted to measure the knowledge, the items that will be designed will be the adding marks of each of the items that the participant have able to answer correctly. Okay, and then you will total it up. Okay, let's say, and then you will have that particular score, and then using that score, you have generated a different range to tell that whether the respondents have poor, moderate, or good knowledge. All right. Okay. So I have putting here example. If let's say for questionnaires that they're using a 5-point item scale. Okay. If they are just measuring the 5-point item scale, then we will call it as ordinal scale. Okay. But if a total score of the instrument is based on the interval scale, okay, when we have a total scoring of all of the item, then then the outcome, the score from that particular instrument, we can use it more. We can use more inferential analysis. So that we can do the test for the differences. We would like to see the association, correlations, or we would like to measure the predictors, so on and so forth. Okay. So when you wanted to design, to include the scoring for the instrument, there are several questions that we have to bear in mind. Okay. Number one, on how are you going to calculate the scores or the sub-scores. Sub-scores meaning if you have a few domain under. Okay. Whether it's adding all the items or only use the mean score for each of the item, or you would like to calculate Z scores for each of the item or for the overall score. Number two, were all the items equally important, and or you will use implicit certain weights. Okay. This is what been mentioned before. Okay. The total score, when we have the total score calculated as the mean of the mean score for each subscale, it will be different than the total score calculated as the mean of all items. So if let's say you wanted to measure the attitude, okay, attitude towards something, all right. So whether it's, let's say you have 10 items under the attitude, whether you would like to see the item that been test individually with the mean, or you would like to add all of all the 10, okay, and you get a certain score, and that score you will have a category. They will develop a category, whether it is either 2 category or 3 category. Whether if let's say you wanted to put poor, moderate, good attitude, or a poor or good attitude. Okay, so this must be taken very in detail. And also you have to also bear in mind, if regarding the scoring of the instrument, what will happen if let's say you have missing values. Missing values meaning the respondents may accidentally skip that particular items. Okay, this usually true if we have the manual, the questionnaire being printed on pages and we disseminate to the respondents. Okay, if you're using that kind of method, so if there is any missing values, you must always think of on how to deal with that missing values. If your questionnaire has been developed online, okay, usually this part we should be able to not to having problem with, because when we develop the questionnaire online, we can instruct that particular survey, the type of they will not able to go to the next page until they answered all the items on that particular page. Okay, all right. So when you have created your initial study instrument, so it is very important for you to start the pilot study. Okay, and the pilot study, it is very sensible to test in the same small targeted groups of people. Okay, and why it's very important for pilot study? Because we want to see the comprehensibility, the relevance, the acceptability, and also the feasibility of the measurement instrument. Okay, so while we're doing the pilot study, we will also look into the validity and the reliability aspects. Okay, so for the validity, okay, we have I will tell more in detail using a case study. Okay, so we can see the knowledge and the application at the same time. Okay, and don't worry, when you're doing the pilot study, you must always allow plenty of time for yourself. Okay, there will be a point where you have to revise, and then you rerun again, then you have to revise. Okay, and then you have to rerun again, you have to revise your instrument. Okay. Bear in mind, if your study is the descriptive quantitative, the design of the questionnaire is vital. It's meant everything. Okay, because that will be inside your method section, whether it's under the paper or under the academic manuscript or thesis or dissertation. Okay, so we will look carefully into how the questionnaire has been developed. Okay, it's okay for you to take quite some time during the pilot study for you to produce a very good instrument But once you have that particular instrument, you can easily start your main study and you can disseminate it to your targeted population. All right. Okay, so this is the case study that I would like to share with all of you. Okay, and this project has been done by my previous PhD student. So, I mean, he was the first that graduated with PhD in pharmacy from MAHSA University. Okay, is Dr. Nahlah Samuel Jimam. Okay, so under my supervision, so we have created this. Actually, there were a few instruments that we have developed. So the one that I would like to share with you is this knowledge, attitudes, and practice on the uncomplicated malaria management. Okay, so from the title here, it can be seen clearly. Okay, this study would like to assess the knowledge, number one. Okay, so that will be your construct and your domain. Number two, it will be the attitudes. Okay, number three, it will be the practice. Okay, and we know that this short form, use the short form KAP. So this KAP is looking into the uncomplicated malaria management. Malaria, as all of you know, okay, we have the complicated, we have the uncomplicated malaria. So the term has to be very, it has been developed, we have developed it to be very specific to cater the uncomplicated malaria. Okay, so let us look. This is what I mentioned from the beginning just now. Okay, we must know the reason why we wanted to develop a new instrument. Okay, for this study, okay, we have seen that there is a big there's a gaps. Okay, in terms of the healthcare workers' knowledge, attitudes, and practice that will influence their quality of management of the respective ailments. Bear in mind, we are using the words here, healthcare workers, not healthcare professionals. Okay, healthcare professionals, we know who they are. So healthcare workers, the coverage is more. When the coverage is more, so we already have in mind the item. It must be able to cater all different kind of people that under the group of healthcare workers. All right. So from the extensive literature review, what we found is like there was scanty information on the valid and reliable instrument to assess the healthcare workers' knowledge, attitude, and practice on the uncomplicated malaria. Okay, this malaria, I mean, if it's in African countries, it become very prevalent. It's very prevalent. So my former PhD student came from Nigeria. So for his country, Nigeria is become a very main public issues. Besides the current pandemic COVID-19, so the malaria has been there for ages. All right. Another thing that we have to bear in mind, okay, when we're developing the study, okay, which of the validity and reliability method that we are going to use, okay. So for our study here, we use two different theory for validity and reliability. Number one, we are using the classical test theory. So I'll mention throughout the presentation the CTT. Okay, and we also use the one known as item response theory, IRT. Okay, the classical test theory, basically these are the one that we able to use the SPSS, for example, to do the factor analysis, to go for the Cronbach alpha. Okay, so these are what we call classical test theory. For the item response theory, this one involves the rush measurement model. Okay, so we are using both. So we are using the classical and also the item response theory. So from here, we can see that we wanted to make a very extensive reliability and validity test so that our instrument, when it's being developed, it should be able to cater all the healthcare workers, the targeted population, to measure the knowledge, attitude, and practice. Okay. All right. So this is just a little bit on the knowledge on why we are using the CTT and the IRT statistics when we are doing the validity and reliability. Okay, I think I will skip this. I will show this table. I think it will be better so that you can see it clearly. All right. So why we are using the CTT and IRT? Number one, if you look at the area for the test, okay, for the CTT, the test rely on the single total model. Okay, but for the IRT, we can involve item score models. Okay, for the shape of model relationship, okay, for the CTT, we can see the simple linear relationship between the item score and the construct score, whereby for IRT, we can see the curvilinear, which is the non-linear relationship between the item score and the construct score. Okay, for CTT, the assumption will be it is a weak model and easy to meet by test data, whereby the IRT, it is strong model and more difficult to meet with test data. Okay, and the one that the unique feature, if we compare between the CTT and IRT, will be in terms of the item ability relationship. Okay, item ability relationship meaning we are not just looking at the item, but we're also looking at the person ability. For CTT, we are not able to measure the person ability. Okay, but for the IRT, we're able to measure both. We're able to measure the item reliability, validity, as well as the person's ability to answer our instrument that we developed. Okay, we also have another area, the difference. If you look into the standard area of the measurement, for the CTT, it will be constant and it will not depend on the ability, as I mentioned before. But for the IRT, it will depend on the ability of the person and the difficulty of the items. Okay, looking into the invariance of the item and the person statistic. Okay, for the IRT, it will be yes, item and person parameters are sample independent, and it will be accepted if the model fits with the test data. But for the CTT, it's not able to do so. All right. And the good things about the IRT when we're using the rash measurement model through the rash analysis, if let's say our targeted population coming from a vulnerable population, let's say for example, we are looking into AIDS patient, disabled people, prisoners, certain unfortunate children, let's say abused children, abused mothers, okay, which is very difficult for us to easily get the population. So the IRT through rash analysis, when you're doing your pilot study, at least you can be able to use lesser amount of respondent. Okay, so that you can use more respondent in your main study. So that is the beauty of using the IRT compared to the CTT. For the CTT, there are major rule of thumb. I believe that for those of you that really highly involved in the validity and reliability, one of the classic example of the rule of thumb is like one item multiplied by five respondent. If let's say you have 10 item, then it should be your pilot study should be 10 multiplied by 5, so you should have 50. Okay, it will be easy for you to get 50 respondent for 10 item during the pilot study if the respondent is easily to get, like general public. Okay, but if a respondent is very difficult to get, okay, maybe a certain disease that is not prevalent in your hospital, okay, so the IRT will be the method of choice. Okay, so we look at the objective of the study. Remember from the beginning of the, on how to develop, you must have what is your objective research question. I'm not putting here, but go straight to the objective of the study. So this instrument we want to develop, and we want to assess the instrument for assessing the healthcare workers KAP on the uncomplicated malaria, and we are using the classical and modern psychometric methods, the CTT and the IRT. All right. And the research design for this will be the cross-sectional. Okay, please bear in mind when I mentioned just now, when you wanted to develop your item, okay, remember the one that I mentioned, the recall period. If you know that your item is can be used just for the cross-sectional, then it will be easy. If let's say you wanted to design a questionnaire that involves some recall period, then the words that you're using there must show that it is a recall period. Okay. All right. So the one that I'm sharing with you is the cross-sectional study. Okay. So this study been conducted in the different primary healthcare facilities in Plateau State in Nigeria. Okay, and the data collection period for the pilot study, it was done between February to April 2017. Okay, and of course, before we can conduct this study, you must always make sure that you have obtained ethical clearance, ethics approval from your own institution, from your university, and the place where you're going to disseminate the questionnaires, the targeted population. Okay, so like for this study, the ethics approval being granted by the MAHSA University, as well as the Plateau State Ministry of Health in Nigeria, and also the directors of the primary healthcare facilities of the local government authorities. Okay, so this must be ensured at the very beginning before you do your pilot study. Okay, so during the pilot study, for the pilot study, as I mentioned before, the calculation of the sample size played a very important role. Okay, so the method of sampling and also the sample size calculation. If let's say if you only use the conventional test theory, the CTT, as I mentioned just now, okay, you have to follow, the very there are few rules of thumbs, but the one that commonly being used for the CTT will be 1 item multiplied by 5. Some suggesting 1 item multiplied by 6 up to 10 respondents per item. I'm talking about per item, not the whole questionnaires. So imagine if you have 20 items, if you're following the rule of thumb of 5, so you have to have 100 respondents. Okay, this is for CTT. All right. Okay, so this is why I highlighted here. So you have to know, you have to calculate what will be your sample size calculation if let's say for the whole targeted population, and you should be able to take about 10 to 25% of your calculated targeted population sample. So the number is going to be used for your pilot study. Okay. All right. So this is what the inclusion criteria that we are focusing on when we're developing this instrument. As mentioned from the beginning, it will be for the government primary healthcare facilities and those that train healthcare workers between 18 to 65 years old that work within the government PhD facilities. Okay. So when we're looking at the instrument development, okay, so if you can look at the chart there, okay, so we have generated some relevant variables, okay, which is this is what resemble the our study statement, the research question, the research objective, okay, and then after all the extensive review that been done, okay, it has been drafted a self-administered healthcare workers KAP, okay, for the uncomplicated malaria. So originally it was 27 items. Okay, this is at the beginning of the stage. After it has been, this is before undergo the pilot study. Okay, so before undergo pilot study, meaning it has gone through this extensive validity in terms of the content validity. Okay, so in terms of content validity, usually we will do 3. There are many validity, but usually we will do 3. Number 1, it will be the phase validity, content validity, constructive validity. Okay, so at this stage, we have done the phase and content validity extensively. Okay, so at the beginning, it was 27 items. Okay, so 16 for knowledge, 6 for attitude, and 5 for practices. Okay, and you can see here the score, the total score. So if they score 1 to 7, we will categorize as poor. 8 to 11 categorized as moderate. 16 to 12 categorized as good for the knowledge items. And then for the attitude, between 1 to 14, it will be poor. 15 to 20, it will be moderate. 21 to 30, it will be good. And then for practice, from 1 to 12, it will be poor. 13 to 17 will be moderate, and 18 to 25, it will be good. Okay, so we already defined the The construct domain would be knowledge, attitude, practice, and these are the scoring, okay, and then the category. Okay, so this has been mentioned just now. We have done the extensive validity. Okay, I will show you what will be the outcome of the phase validity and the content validity. So for the content validity, the experts administered corrected draft scale. We are using the 4-point Likert scale. Okay, as mentioned before. That's why the selection of the scoring for the item is very important. If we are usually for the public, we will give the 5 Likert scale, for example, because 5 usually the middle will put the as a comment, either no comment or neutral. Okay, but for the healthcare workers, we would like them to state their opinion directly. Okay, for the attitude and practice. All right. For the knowledge, we're using the score which is 0 and 1. Okay. So for the content validity, we are using this ICVI and also this SCVI. So we use the item content validity index and we use the scale content validity index. So we want to ensure the instrument will show the relevance, clarity, simplicity, and is a comprehensive. Okay. So this is what we have done overall that I showed in this table. So, okay. As mentioned from beginning, we are using the CTT and the IRT for validity and reliability. So under the IRT, we have the item and person. Okay. So for the CTT, for the reliability, we are checking on the internal consistency as well as the test retest. And then under the validity for the CTT, we have we have done the internal validity and as well as the external validity. So for the external validity, we are looking at the convergent and discriminant validity. For the internal validity, we have the exploratory factor analysis and also the confirmatory factor analysis. And then for the EFA, we have the factors extractions, and as well as for the CFA, we will show you the result for the good or fit statistic. Okay. So a little bit explanation on the psychometric evaluation for the construct validity using the exploratory factor analysis. I hope I still have the time. I try to squeeze everything in 1 hour. Moderator, ma'am. Okay. So for the EFA, when we're using it, we have to always remember that we have to have we have to obtain the sample size requirement based on the Kaiser-Mayen-Olkin, the KMO. Okay, we wanted to look at the acceptability of the scale and also the floor ceiling effects. So under the EFA, we have the factor extraction method. Okay, we are using the PCA. Factor retention, which is we're using the eigenvalues greater than 1 rule, which is the Kaiser criterion. And also the factor rotation, we're using the Varimax rotation method. Okay, and for the CFA, confirmatory factor analysis, okay, so we are having these, okay, we want to assess whether it's fit to the model or to the data using the goodness of fit indices, which is we have the SRMR, the RMSEA, and also we have the C mean over the F. Okay, which all those ranges. Okay, and under the convergent and discriminant validity, so we are using the Fornell-Lacroix criterion to estimate the convergent and discriminant validity for the scale. And if the construct average variance extracted more than 0.5, we will indicate it as convergent validity. Okay, all right. So in terms of the reliability, so we did the internal consistency, which is using the Cronbach's alpha coefficient, okay, which is if the value of 0.6 and above will be acceptable, okay. And we also did the test retest reliability, whereby the values of 0.79 and above indicated good reliability of the instrument. Okay. For the IRT, we use the Rush model, okay, and the software that we use is Bond and Fox software. we look into the items and persons behavioral consistency and the items and persons reliability. Okay, so there are some parameters that we look into under the construct validity. So we have the mean square in fit and out fit, standardized Z, point measure correlation coefficient, all right, item and person reliability and separation index value of more than one. So we are using all this range that been put on the slides. Okay, so this is basically I showed, okay, the one that we are getting from the particular instrument during our pilot study. So if you can see here, the number of healthcare workers that we used was 121. Okay, and you can see here the way on how we make up the range. Okay, and the way on how being for let's say for the category of the monthly salary. Okay, so this is what being used usually in the study for Nigeria. They have the category of if it is less than 18,000 naira or between 18,000 to 50,000 or more than 50,000. Okay, if let's say in Malaysia we have a category whereby we call it as B40, M40 and T20. So if it's in Malaysia, it's like below 40%, which is the considered as a low income, and then the M40 considered as middle income, and the T is considered as the upper income. So every country have their own particular defined range. So if you wanted to look, if let's say if you wanted to have some, if you feel that the salary can play some important point as your independent variables, so you should be able to to know what is your country categorization over when we put as the low income, middle income or high income. Okay.
Okay,
All
so ma'am,
right.
we'll be having 5 more minutes if you can take for presentation.
Okay, sure. All right. So these are the some of the descriptive summaries, and also we have come up with the categorization of the scores. Okay, for their levels. Okay, so these are the results that we have gathered after we did the content validity. The one that mentioned just now, we are using the SCVI, okay, and the ICVI. Okay. So if you bear in mind, okay, this is done when we have the 27 item, is before the deletion. Okay, and this also the EFA, the result is before the deletion. Okay, so we have at that point it was a total 27 items. Okay, and we also done the EFA. Okay, so when we done the FA, this is for 18 items after we deleted 9 items. Okay, and the process when we deleted the items is not just based on the CTT, but we also compared with the results that we get from the IRT. So meaning we use two validity and reliability theories for us to delete the items of the one that we have constructed from the beginning. So this is a very massive validity and reliability exercises that we have done. Okay, and this is what we obtained for our study for the goodness of fit. Okay, and this is to show the conversion and discriminant validity of the 18 item scale after we have deleted 9 of them. Okay, and this is the reliability of the instrument before deletion and after deletion. So we can see the difference, let's say for example for the attitude domain, before the deletion the Cronbach alpha was 0.59, but after deletion it become better 0.76. Okay, so this is the construct validity by the rash analysis before the deletion. So these are all the results for the 27 item. Okay, so we look into both results for the CTT and RT as I mentioned before. So when we delete the items, it just happened that the same item that give the issues under the CTT also gives some issues when we run the rash analysis. Okay, so by using both method, we can see that we happily remove the 9 items from the 37. It become total 18. Okay. So these are durability by rash analysis before the deletion and after the deletion. Okay, so we can see the better improvement. So for the conclusion, okay, from our study, because we have been using both theories for the using the CTT and IRT, we should be able to delete the unnecessary items for us to come up with the validated and reliable self-reported outcome measurement to assess the healthcare workers' knowledge and attitude and practice on the uncomplicated malaria. You know, sometimes, if I still have time before answering the question, sometimes, I understand that the time that we have committed, when we are developing the items for the questionnaires, you may have come up with 40 or 30 items, okay, and then it will be, because we have the sense of attachment to the items that we have developed from the beginning. So after we run the pilot study and then using either the CTT or IRT, or you're using both, they will come into situation whereby we feel that, oh, you have putting all the efforts from the beginning, and then suddenly we have to delete 10 out of this 30, and then from the 30 items, for example, you left out with only 20 items. Let's say in my case, from the 27 come out with the 18 items. It's okay. Okay, we have to put that particular attached emotion put aside. Okay, because if you really look back, for those people that using both either the CTT and IRT or using either, when you look back, when you look again at the item that being deleted, suggested for us to remove from our construct, from our domain, we can clearly see that some of the items that we put is actually, it can be redundant. It can be redundant, or it is not suitable for that particular targeted population. Okay, so please have like a fair in mind, it's okay for our items to be deleted even though you have spent a lot of efforts to come up with all the items. The important things is, like, we wanted to have a reliable and a validated instrument, so that the outcomes, the results that you will get, okay, it will be very meaningful. So with that, I thank all of you for your attention, and I think I will let the madam moderator to throw some question, to give any question, any burning
Thank you
question
so
that you
much.
have.
We can go
Thank
for
you
a
so
couple of
much,
questions.
Prof. Nahlah.
Oh, have a
It
couple. All
was
right.
very
Okay. Sure.
informative session.
Uh-uh.
And
Thank you, ma'am.
it was too much to take from this session. Yeah, actually, I have to think a lot, but I think I have missed a lot also in understanding the things. Because,
Okay.
yeah, and also I'm very, it's my pleasure, like you have mentioned so many critical points to be considered before developing such kind of health instruments. I
Yes.
have some questions in a broader sense, not might be so directly related to your work. So you have taken the samples from Nigeria. The location is specific. So how can you make it a global instrument? With
Okay. All right. Okay. It's very good question. When we're talking about when we talk about the development and validation of the instrument, 1 hour is not enough, which is true. There are many informations that being shared. Okay. In a very
yeah,
short time, I have to list everything. Okay. Usually we will have a workshop or session that be conducted for 2-3 days, and this usually excluding the on how to learn on how to do the validity, excluding on how to learn to do the reliability using these two different theories. Okay, all right. If let's say based using the examples that I gave just now, the case study. All right. So the questionnaires, okay, on the knowledge, attitude, and practice have been developed to target actually the healthcare workers, not professionals. It's healthcare workers, okay, towards the uncomplicated malaria. And then and then the data collected is from the Nigeria, okay, because of the logistic purpose. All right. But if the questionnaire is going to be used outside Nigeria, it is highly recommended because the questionnaire, the item has been designed to cater all healthcare workers in general. But
Okay.
the only thing that the whoever that wanted to use these questionnaires, they must do the reliability and validity based on their sample population. A very quick one, meaning they don't have to do very, if they wanted to adopt, not adapt, if they wanted to adopt this questionnaire based on the example of the case study that I've shown, okay, the thing that that you can do is like just do a simple reliability and validity test, okay,
Why have
either
you
using the IRT or the CTP.
okay, why have you only taken malaria? Why not other uncomplicated or neglected kind of diseases?
Oh yeah, this instrument, because it is designed, it has to be very specific, because malaria we have uncomplicated, we have complicated. So if it's complicated malaria, so the design of the items, the words that we're going to put in will be slightly different, especially at the knowledge part. Knowledge part to be slightly different. The attitude and practice also will be slightly different because we are catering the complicated. Because we know that the uncomplicated is the one that usually, if it is being neglected, it can turn into complicated malaria. So the study is basically we wanted to know at the very beginning when the patient, we can say like either they surrender themselves or when the patient attended the clinics, okay, because the disease is so prevalent. So this study would like to see the uncomplicated one, not the complicated malaria, because the complicated malaria usually is not being attended by the general healthcare workers. The complicated malaria, it will be dealt with the health professionals. So if you wanted to have a general healthcare workers, okay, so this is the reason why we are having the uncomplicated malaria.
Okay. I would like to ask what audience would you like to target for your health instrument?
What
Again, it is
audience?
specific. Is
Yes,
it again specific to Nigeria?
No, I mean if we use the example of my case study, so this particular the new questionnaires that we have developed, it can be used in other countries as well. Okay, as long as the target population is healthcare workers, it can be
Okay.
used. It can
It
be
can
used.
be
It can be
used
used
anywhere.
anywhere.
So
Yes.
it doesn't affect the metabolism part, the genetics part, if the samples are different with respect to other countries.
Okay, if we disseminated the questionnaires, because the selection of the items and wording that we put, it should be able to be answered by all of the healthcare workers. So there is less complexity in the question because we are not including specific only healthcare professionals. If you're putting only the healthcare professionals, of course the wording of the items will be different, and then the difficulty level of the item also will be different.
So what are your future plans with this? Like where you want to take it or what type of other diseases you want to incorporate? What type of other samples collections you are planning to take?
Okay, for okay, this is outside of this slide presentation. Besides we develop the questionnaires for the healthcare workers, we also actually develop the questionnaire for the patients as well. Okay, and then the questionnaires for the patients, we also developed towards the uncomplicated malaria. Okay, because it was the malaria is very prevalent in Nigeria. I think many countries also have similar issues. The number of people being diagnosed by malaria, we put aside the COVID-19 first, but if we just focus on the malaria, it has been for years in many countries. So for our study, the one that I use as an example, so we have developed the questionnaires for the healthcare workers. We have developed also the questionnaires for the patients on the knowledge, attitude, and practice towards this uncomplicated malaria. And this can be used in any countries that have a similar prevalent issues of malaria.
Okay. Also, you mentioned about pharmacognosy, which is a very interesting branch. Even I am working into it because I am into multi-drug resistance. So, are you mentioning about these kind of natural products in the treatment of malaria?
Okay, for under this item is actually we for patient, not for healthcare workers. For patients, there is item that we are wondering, whether they would like to seek treatment directly, with the healthcare authorities, or they would like to how to say self-medicated. So we did include that in our item because what happened is like I think different countries have their own self-medicated in terms of using some traditional or complementary medicine. Okay, there are maybe some certain leaves that they believe that can help to can reduce the symptoms of the malaria and everything. Okay, so in the questionnaires we did put that for the patients.
Okay, so you mean if they have the self-assessment, they have to eliminate the visit to the doctor.
Not really, because we wanted to know actually, because because some they may came, they may seek for treatment when it is already too late. Okay, while they're experiencing all the symptom, they may take it as, like there's nothing much, it's just pain at the joint, just have this fever, I'm having this pain, in the muscle area, this and that. Okay, so there's some people, they take it very
Just for the
easily because
symptoms, you mean?
yes, because they feel it that it is something that which is very norm to them. They feel that it's a norm thing, but it's not. Okay. So the one that I used the example of the case study just now, okay, we did look into that aspect for the patients. We did look into that.
You mentioned about self-assessment for curing such kind of symptoms, but there are also other tools that can give you this kind of medications. So how different would your instrument be?
Okay, when we look at the beginning, we must know what will be our research question and research objective. So this instrument been specifically designed to look into the knowledge, attitude, and practice towards uncomplicated malaria among a patient, and as well as the one that I presented just now among the healthcare workers. Okay, so this has been made very particular. If let's say if we would like to look into other diseases, so we have to change the content, because the aim for us is actually, it is good for us to have a very specific questionnaire. We call it as like a disease specific questionnaire, so that the respondent, when they're answering that particular questionnaires, they're just focusing on that particular topic only. It's not just widely, rambling here and there. If we talk about the self-medication, even if let's say if we're thinking to develop a self-medication instrument, for example, it has to be a disease specific as well. Okay,
Yeah.
it is, if we make it very general, it will be difficult for us to analyze the result. It's like the respondent is actually answering based on what? Is it based on their experience? Is it based on their perception? Or is it based on their specific disease? So we have to put it very specific. This is the reason why the specific instrument, disease specific instrument, is very important for us to develop rather than general.
Yeah, so you mean you will be archiving all the data of the healthcare workers or patients that will be using your instrument so that later it can be helpful for giving any kind of treatments to them?
Yeah, this data is actually very helpful, especially when we wanted to do the counseling part to the patients. Okay, beside the counseling part, it can also, because this study was conducted in Nigeria, and then the health authority is really looking forward to the outcomes, so that they may think of some, let's say for example for the healthcare workers, they may think that there should be some more training to be given to the healthcare workers, And then some of the outcomes to the policy makers also, they were looking into for a pharmacist to be allocated in each of their primary healthcare facilities, because at the moment the pharmacist is not always available in every of their primary healthcare facilities. Okay, the one that the highest there, if let's say for the pharmacy world, it will go up to the just the assistant pharmacy. So the pharmacist not there. All right. So based on this outcome, so it will help their policy makers to look into the allocation of the types of healthcare workers that they're going to have at each of the primary healthcare facilities, and also they will look into the budgeting in terms of the human resource, and also the treatment that they're going to allocate to the respective patients.
Okay.
Mm.
Very informative session, Prof. Nahlah. Looking forward to have
Thank
more
you.
interaction in future, because even I am interested in this kind of what I can say, in we call it as tool, because I'm a bioinformatician. So I would like to develop a database or an instrument or a tool, whatever you call, with respect to multi-drug resistant bacteria having some kind of treatment as a source from this, we can say, natural products, synthetic products, and also available drugs and antibiotics. So that if
Mm-mm.
some, so it will be in a broader sense, because I'll be incorporating different bacteria and their resistance. That's the reason I asked you, like, how, in a broader sense, how you're planning to do it.
Mm-mm.
So yeah.
Just for additional information, okay, we have done successfully the pilot study, and we have done the main study as well. Okay, we have recruited like thousands over of the healthcare workers and also patients, and some of it already available in some of our publication. If any of you just type the words uncomplicated malaria, you should be able to find those findings, including our instruments there.
Yeah. Thank you so much, Prof. Nahlah. Thank you. From my side, I'm done with the questions. If anyone wants to ask, you can proceed.
Thank you so much, ma'am. And I think so. Before we end this, ma'am, I'd like to say all the participants who are watching us live that everyone will be receiving an email shortly with the feedback link as well as with the certificate download instructions as well. So nobody needs to panic about how they are going to get the certificates. So as soon as the webinar ends, everyone will be receiving an email in their mailbox with all the certificate and the feedback link instructions as well. So before we end this, I would like to thank Professor Nahlah for the beautiful presentations he gave. I think it was such an informative session, and it was also beautifully moderated by Dr. Shama ma'am. So
Thank
thank you so much, ma'am. And before we end this, we would like to assure everyone that we'll come up with more such interesting webinars in the near future as well. So till the next time, we would urge everyone to stay safe during this pandemic time. And till the next time, goodbye from our side. Thank you so much.
you. Goodbye. Thank you. Have a nice day.
Yeah, small love to everyone.